Welcome to Get Moving TV. I'm Dr. Chris Land and I serve as your host. Here in Ventura, we're a little beach town. We have some remarkable superheroes. We have services that we bring to children. We have people flying over our city, saving our children at night. And that's really what this show is going to be all about. I get a chance through just meeting people, to meet these superheroes and bring them for you to meet them. So Jim, welcome to the show.
Thank you, Doc.
So how did we meet?
Well, we met because I am kind of spearheading a new charitable organization linked to the city of Ventura around one of my passions, global health. And you kind of hooked me in here because you're interested also in one of my other passions, which is channel swimming. Yeah,
and that's one of the things. It's just there's so much that we want to do for this city. It's a wonderful place to be. And we have problems with access to health care. We have services we need to get to developmentally disabled children and adults. We need to get kids growing up here. And it's time as adults in this city to really take responsibility for this. Now you have kind of an interesting journey you got to here too. So one of the things that we do is we try and get into the pools in Oxnard and teach inner city kids how to swim. They've never been in a pool before. And you grew up around here. Of course, you've always known how to swim.
And I actually learned to swim about 6 years ago, and I was sitting in a backyard at a barbecue in Midtown Ventura, and a couple of my buddies said, hey, we want to do a relay triathlon in Carpinteria, and you're going to be the swimmer. And I'm kind of like, and I was a little bit not interested. But they asked me because I had been surfing in previous years, but I just had a daughter, so I wasn't swimming a lot, kind of wasn't doing much exercise. Why? And said, you know what, I'll give it a try. And I had a neighbor and a friend, Dr. Bryant Lum, a local ophthalmologist, and I knew that he had been a high school and a college swimmer. I knew he went swimming most every morning at the crack of dawn, and I just figured he had a key somewhere and turned on half the lights and started swimming. And the first morning he took me, there's 40, 50 people in the pool, and there's this whole phenomenon called master swimming that I had no exposure to and no idea that occurred, but happens in pools all over the country every morning, and we happen to have an especially strong and close-knit group here in Ventura.
So where do they swim?
We swim at the Ventura Aquatic Center on Kimball. And that's just a great world-class facility. Members of our club were instrumentally involved in getting the pool built. And great city programs there. And then the Buenaventura Swim Club, the Ventura County Masters, the group that I swim with, is part of the Buenaventura Swim Club. We just celebrated our 50-year anniversary. So we've been kind of the main swimming group in town for 50 years, and it's beginners to Olympians. And I was in the beginner side, and you know, kids 6 years old up to, if you're 100 and want to swim, you're welcome there. Very good group, caters to every level of swimming, and a lot of people get it. Swimming's great. It's great exercise. It's a great community that's doing it, and I kind of led from there to doing triathlons on my own, and then I look out from my house at Anacapa Island and started kind of scratching my head and saying, huh, I wonder if you can swim from there. And kind of started doing the research, and lo and behold, one guy from Ventura was about to do it. This was back in 08 or 09. He was about to do it, Jim McConaughey. He was the first Ventura guy who ever swam from Anacapa. And the next year I mustered out how to do it on my own with a lot of guys, local swimmers' help, and from there have been swimming quite a few channels and having fun doing it.
Well, occasionally I take my dog for a walk on the beach, and he thinks those are seals out there swimming back and forth. But so you get off the shore at Anacapa Island and swim to
back. Yeah, the closest point from Anacapa, and that's kind of my home swim, my favorite swim. I've done it 4 times. The closest point from Anacapa is actually Silver Strand Beach. So once I ended up landing in Ventura by the harbor because of the current, and I left from the other side of the island. The most direct route is to Silver Strand, but us Ventura guys are just starting to get it wired because there's a lot of weird things that happen with the current. And my last swim 2 weeks ago, I should have gone down to Wanimi. It would have saved me about an hour. Instead, I just fought the current upstream for a good hour. So,
yeah. So I generally try and swim in. How big are waves? How many sharks?
Well, I can't say I've ever seen a shark myself, but when I was getting on the boat for my last swim 2 weeks ago, the captain said, oh, I just saw a 14-footer out there 2 weeks ago, but I got my shark shield, which was a shotgun. But I personally haven't seen one, and you just try not to think about them, but there's a lot of great sea life. Dolphins swim around you all the time. You hear them come in. My last channel swim 2 weeks ago, about mid-channel, a baby sea lion decided to befriend me. And for almost an hour, he was there for like 20 minutes and then gone for like 10 minutes and back for another 20 minutes. He was dive bombing me and playing with me, and my kayaker, the water was clear enough that he could see it. He's just over there laughing because he was charging right up at my face from underwater. For a while, he would come up right under my hand as I was pulling and then zat right out of the way, just 5, 6, 7, 8 times in a row of doing that. Jellyfish, there are quite a few jellyfish. You get stung, but you just kind of get used to it. Yeah, those are the main sea lives. Pelicans will just kind of sit in your wake.
So that must be quite a meditation / psychedelic experience after a while.
Yeah.
My long distance running friends kind of get to a different place. What have you tried to represent what happens? Have you tried documenting it all? Or?
I always say, hey, every time that I do a swim, I'm going to write it all down, but I never do. However, I was involved in something kind of cool that hopefully a lot of Ventura folks have heard about, the Ventura Deep 6 swim relay. And we set a world record for open water ocean relay swimming, and we swam 202 miles. This was in 2010, September 2010, almost exactly 2 years ago. We started in Ventura because we're all Ventura guys. We swam up to Santa Barbara and down to San Diego. So it took us right about 100 hours, so a little over 4 days. And basically 6 of us swam day and night. Relay swimming for whatever reason, I can tell you the reason, is set around 6-person relays. You're in the water for 1 hour at a time, you rotate around 6 people until the swim is done. So there's always someone in the water, you always rotate on 1 hour. So on that 4 days, I was the 5 a.m., 11 a.m., 5 p.m., and 11 p.m. guy. So every day, those 4 times a day, I hopped in the hour and swam an hour. And then when I was done, Jim McConaughey tagged off on me and he did his hour 4 times a day. So we did that 4 days in a row and ended up 202 miles later in San Diego.
And what did you have to eat when you got on shore, just out of curiosity? Or
Well, we had a boat and we had a cook on the boat. It was a nice setup. And what did we eat? A lot. Yeah, they just kept the food coming all the time. On a solo channel swim, you don't, well, I don't eat anything. Most people don't eat solids. Bigger guy like me can take maybe 350 calories per hour. You can ingest that. A smaller person might be 275. And depending on your size and your inclination, maybe 18 to 27 ounces of liquid per hour. So we have basically powdered drink and water, and we mix the two together to get the optimal mix of calories and liquids. And I feed every half hour off the boat. They throw me a sign and I swim over by it. They throw off a bottle on a rope and I suck it down for about 20 seconds as they're telling me my stroke count and my distance to shore, and off you go again. You can't sit around because you go hypothermic. So
yeah, wow. Well, so in terms of your next superhero activity there, so besides flying around the city, we're going to save some children, it sounds like, and
yeah, that's
adults,
the goal.
So.
It's kind of related. We've started a group called the Ventura Global Health Project. And the idea is that local business people and local doctors and local community members will all get together to provide healthcare services to underserved populations. And totally community-based, not religious, not political, just Ventura folks. And the idea is, I'm just a huge fan of the Ventura lifestyle and the Ventura ethos, and most of us that live here are pretty lucky. And I love our attitude too, and I think we all kind of have a service kind of attitude and a community type of attitude, and I learned that on our relay swim. When we did that world record swim, we were all Ventura guys, but we didn't expect anyone to be interested. We thought, swimmers would be interested, but really the whole city kind of rallied behind us. And for, 4 out of 5 days, it's on the front page of the Ventura Star. And when we, people are Facebooking in, there's over 1,000 people following us on Facebook, and most of them are locally based. Real exciting to be part of such a community-based thing. So take that, and on a tangent, I followed a group called Direct Relief up in Goleta for several years. I've been lucky enough to be peripherally involved with them. Just an amazing organization. They started in 1948 after World War II, when basically Europe and Eastern Europe were still starving and had nothing, and realized a need there and started shipping supplies to them. Well, 60 years later, they're still operating, and now they're equivalent of a $250 million company, right? But they give everything away. Yeah. So they're so well established now that they have incoming donations of drugs from pharmaceutical companies and supplies from supply companies, and they donate these all around the world. So I've been kind of following them for years, and I've always kind of it becomes a time to, in your talk, get moving, right? Yes. It's just kind of my time to get moving. It's kind of my time to get moving. And so looking at my strong community focus, looking at what they do, I kind of thought of a way to combine the two. And that is, hey, these guys focus on medical supplies. And here we have in Ventura, I'll call it, I don't know if we're overserved medically, but we definitely have our share of doctors and medical professionals to adequately serve our population and perhaps a surplus. And I started thinking, hey, what happens if us business guys and doctors got together and we start saying to the doctors, hey, if you're willing to do the volunteer work, we're willing to run the company and we're willing to pay the expenses. And when I started talking to doctors about it, they were a little bit shocked because many doctors like you who have done a lot of both international and local pro bono volunteer work, and it's kind of a given in that business that you pay your own way. So the idea when I started talking to doctors is, how about we pay for it? They were shocked and surprised in a good way, and the response has been pretty overwhelming. So we've kind of launched, and we're looking at 4 major programs that we want to be involved in, and frankly, I'm not sure all of them will get off the ground, but that's the goal. One is kind of what we call week-a-year types for local doctors in private practice. Well, I'm going to step back a little bit. Our intention is to establish partnerships with local clinics, hospitals, or other nonprofits with a focus in Central America. The reason there's plenty of underserved populations. Our interest in Central America is we can logistically service it easily. And remember, we're business guys, so we're about efficiency, right? It doesn't do us a lot of good if we spend all our budget sending guys to Africa for a week. We can get them on the ground in El Salvador, Honduras, and Nicaragua in a day, and without a huge travel budget. So we're looking for partners in Central America who basically have developed a demand, and they have a patient demand, but they don't have all the supply of medical services that they require. So we're hoping not to reinvent the wheel. What we're hoping to do is overlay our perhaps small surplus of medical services and doctor services here in Ventura to help underserved populations that have kind of fallen through the safety net of healthcare. So again, one program is doctors in private practice who will be on 1 or 2 week rotations. Another program is we're working with a family residency program at Ventura County Medical Center, which is how we came to meet, about doing we have a great residency program here, and the residents are on 3-year rotations, and there's discussion about setting up a 1-month elective rotation in a charitable program. So that's the second program we're discussing. We're discussing setting up a kind of a home-crafted telemedicine system where we can do office hours, weekly office hours from here to Ventura to Central America, and have doctors staff those office hours. And we're talking about doing an annual trip in the likes of a group called Helps International, where they they have all the medical, basically mobile surgeries, and you move more doctors in and healthcare professionals in at one time to do a lot of see a lot of patients, do a lot of surgeries, do a lot of dental exams in one short period. So those are the 4 areas where we're kind of focusing.
That's perfect. I think when we've been to Peru, just all the desert sand, they get pterygium, they get scars over their eyes. And it's a miracle when the ophthalmologists come in and just do massive things like that. Cleft lip and palate, we go down to Honduras with Dr. Starr, and we've really been able to put in a system of care down there. It's not just being this flying saucer flying over and then we're gone. We really want to change the systems of care. And then exactly the other part, which is you bring up, and that is we really want our residents to see this as a lifetime obligation. This is the Hippocratic Oath. We really need to give back to our community. So I really thank you for making that effort, because we are kind of not the business types, and this has really it's really helpful for all of us.
Good. Well, I need everyone's help because I don't like to fail.
Yes. So how can we help you? How can the city of Ventura and people watching the show help you?
A couple of ways. Doctors and healthcare professionals will be reaching out to you. It might take a month, it might take a year, but we're basically building a database of all the doctors practicing in Western Ventura County and their specialties, and then we'll be doing surveys to find out what kind of volunteer work they've done and what they're willing to do. So we'll be getting to you sooner or later, and hopefully you'll be hearing it from your physician friends. Business people, you know, there's some business folks in town like me that I know have done all right, and I'll probably be hitting you up because we need co-investors. But it's a business whose only profit is service to humanity. It's not going to fund itself, and our intention is not to start out looking for grant money or other types of things. It's to be locally funded. Our hope is that in the midterm or long term, we can build such a well-built charity that it qualifies for some second-round investors of the likes of the Gates Foundation or something like that. But locally, as a community, we need to feed it and make it succeed to get it to a level where a larger scale provider will be willing to take it on because it's such an awesome program.
Oh. Well, Tim, thank you so much for swimming, of course,
yeah.
and then and this new program. So Ventura, we're going to be right back.